Good evening, everyone. Thank you for joining us. Welcome to ALA's Executive Webinar Series, or welcome back to those who joined us last week. My name is Titilayo Mabugunja, and I'm from Nigeria. I'm currently a senior at Yale University studying biology and theater. I'm delighted to be your host for this evening and to relive, in a way, one of the amazing and precious ALA moments. I remember attending the guest speaker series when I was a student at ALA from 2014 to 2016. And despite the unfortunate circumstances of having to practice social distancing, I think it's so special that we get to share this moment and really engage in one of the activities that makes ALA so unique. The heart behind African Leadership Academy is to develop the ethical and effective African leaders who can work together to solve Africa's most pressing problems. And one of the ways it does that is by inviting leaders who are already doing amazing and incredible things across the continent to interact with the ALA community, which is ALA students, the parents, the incoming students, and anyone else who's joining this webinar. Before we start, I want to talk you through some of the functions we'll be using on today's webinar. After our guest speaker gives his presentation, I'll be starting up the Q&A by asking him a few questions and then invite the audience to ask questions too. At the bottom of your screen, you should see a Q&A button and be able to post questions to the panel that way. I'll be monitoring the questions as they come in, and we'll try to get as many as possible answers at the time we have. If you see a question that you really like, please be sure to upvote that question by clicking the little thumbs up button next to it, and we'll know that lots of people want that question answered and try to get to it. Without further ado, I'd like to introduce our guest speaker for today, Professor Yap Boum. He is an epidemiologist, so studies the incidence, spread, and control of diseases. Especially in light of the current pandemic, I think we're all excited to hear from him, because even if you're not a scientist, it's important for us to learn about this too, because we're all affected by the virus. It's important to learn how different fields are tackling it. Professor Yap is the regional representative for Epicenter Africa, which is the research branch of Médecins, also known as Doctors Without Borders. Médecins is an international medical humanitarian organization that provides medical assistance to people affected by conflict, epidemics, and disaster. Professor Yap used to head the research base in Uganda and is currently based in Yaoundé, Cameroon. He has worked on research projects on tuberculosis and malaria, and he was one of the leaders spearheading the response to the most recent Ebola outbreak. He teaches public health to university-level students. He is the co-founder of CameraPad, a nonprofit that develops washable sanitary pads to empower women to allow them to fully participate in their education. Professor Yap is just an inspiring person all around and is involved in a number of other great initiatives and is inspired by the vision of a healthy and wealthy Africa. I can attest to this because I had the pleasure and privilege of working with him last summer in Cameroon. And she is such a visionary person. I could go on, but I've been speaking for long enough. So with that, I'll hand over to you, Professor Yap, for your presentation.
Thank you very, very much, Titilayo, for the kind introduction. And it's great for me to see you again since you've been in Cameroon with us. I will tell my daughter Ashanti that you were the one interviewing me. I'm sure that she will be very excited and happy. So thanks for inviting me to share with you some few things about what is going on right now on COVID-19. And then I will just say some few words. I have a couple of slides. I have a poor internet connection, so it would be great if you can put the slide for me, because I don't have them. I can't put them on. And after the slide, of course, we'll have the question and answer. So before actually starting, I will tell you, if there is something that you should get out of all this conversation that we'll have, is that access to quality healthcare for all should become our just cause beyond the COVID-19. Quality healthcare for all of us should be our just cause. Before going into the actual epidemiology and what is happening, I will give a tribute, first slide, to this man who's called Emmanuel Vondonvogo. He was the father of my wife. He passed away 2 weeks ago, and 2 days ago he was incinerated. He passed away in France, in Paris, a country that has one of the most robust healthcare systems. However, he was at home. He managed to get contact with the health professional, talking about what he was going through, the cough he was having, he was unwell, he was losing weight, and so on. And he was advised to stay home and that he will get care. People will come at home to first collect samples so that they can test him for COVID-19 and then see how to transfer him to the hospital. So he was waiting, and for the last 3 days of his life, he has been waiting, and eventually he died in his bed. And because the pandemic is so overwhelming in France, his body has to stay 2 days at home before being collected and then being brought to the funerarium. In the other hand, different people also die in hospital. So he has the opportunity, I would say, the privilege to die surrounded by his family, except my wife who is with me in Cameroon. So I'm giving a tribute for him. The second person, second slide, is Pape Diouf. This is one of the only African person who was leading a major football club, Olympique de Marseille in France. And he died in Senegal, in Dakar, where he was originated from. And in the statement that was given when he died, he died before he was evacuated to France. As if going to France, running away from Africa, would have given him a better fate. Why? Because we have not invested into our healthcare system. We have not respected our commitment to what is, for me, the most critical thing that we have, our health. Next slide, please. What is happening now in the continent? As per today, we have around 10,000 confirmed cases of COVID-19. I say confirmed because it is definitely underestimated. There are people who are at home. There are people who are not caught by the system. There are people who fear to be screened and tested. And also there are countries where the testing facility are not available in good quantity. Out of those 10,000 cases, South Africa is having the highest burden with around 2,000, followed by Egypt, Algeria, Tunisia, and Cameroon. Cameroon being the second country in sub-Saharan Africa with more than 1,000 cases as we're talking today. 1,000 cases is also underestimated because initially, as many African countries, the disease were coming mainly from Europe. And in Cameroon, we have two major cities, Yaoundé, the capital city, and Douala, the economic city. And most of the people were coming to Douala, and we have not managed at that point of time to follow them all. So from a disease that is mainly affecting imported case, we move to a local transmission of the virus, meaning that the case we are having right now are the case of people who have never been out of the country. So because we have not managed to catch all those first cases in other places, they are now spread in the community, and we are doing massive tracking to be able to find those people who are in the community. But it's quite a hard thing to do. That's why I'm saying that even the 1,000 cases we have, as it could be in other countries, is also underestimated. And out of those 10,000 cases, we are around 500 deaths. Those 500 deaths, which make a case fatality ratio of around 5%, which is quite high as compared to what we've seen in globally with around 1 to 2%. It's less than what we've seen in Italy, where that was at some point around 8 to 10%, but it's also heterogeneous. It's important to always remind ourselves that Africa is not a country, it's a continent. So different countries have different realities. The case fatality rate in Algeria today is around 15%, while it's around 0.9, 1.8% in countries like Cameroon or Senegal. So there is an important disparities among countries. First, based on the number and the type of case that they've been having, and also based on the response. What is important for us today as Africans is not just to end the pandemic. That is a finite game. The disease, the virus, will go as it has come at some point. It might last a bit longer, might kill more people, but at some point it will go. The most important thing that we have to do is to have an infinite mindset that aims to provide quality healthcare to everyone rather than focusing just on ending the disease, ending the pandemic. What does that mean? For me, it means investing more in healthcare, making quality healthcare as a just cause. What is a just cause? For me, a just cause is a specific vision of a future state that does not yet exist. We will all agree that but today, we don't all have access to quality healthcare. But that's our aim. And we won't rest until we get there. Quality healthcare as a just cause means that we have to think for everyone. The vulnerable population, those who cannot have access to healthcare because they don't have money. And this is not only in Africa. You've seen, you may have heard that in the US, in Louisiana, 70% of the people who are dying are Black American people because they don't have social security, they don't have medical insurance, and quite a number of them have comorbidity, obesity, diabetes, and so on. And they don't have access to healthcare. So we need to make sure that those people have access. We need to make sure that the people who are living in our villages also have access to quality healthcare. At some point, our politicians, our business leaders that you will be, whenever they will be sick, they will just fly to London, fly to Paris, fly to New York to get access to a better quality care. But with the borders that have closed, now they have no choice but to be taken care in the healthcare system that they have not invested in. providing that quality healthcare for all has to be done by all of us. And by all of us, I mean you. You, the next generation of African leaders. You should all invest on finding those homegrown and innovative solutions so that we build a healthcare system that is needed for all our community. Our countries, most of them, they have signed the Abuja Declaration, saying that they will invest 15% of their gross domestic product into healthcare. How many of those have complied to that? Rwanda, maybe. South Africa, maybe. Out of 56 countries in Africa, less than 5 have actually complied. On top of that, we've seen a lot of innovation. We haven't had as many billionaires in Africa as we have today. Those people that you know make a lot of money in oil, in cement, in technology, in quite a number of those. How many have invested in healthcare? Very few. And now we are all stuck in that poor healthcare system where we have not invested. The quality healthcare for all that we want should be resilient beyond political, technological, and even cultural change. One of the challenges that we have as health professionals is that most of us are not in a power position, which means the healthcare system is designed by people who don't have real control or knowledge about how we should manage public and global health. But it's critical, if we are not in power, to make sure that those people listen to us, trust us, so that they can implement what we are recommending. It has to be resilient. What are we saying? Some of you have learned about the concept of evidence-based medicine. What does that mean? It means that the great advance in medicine has been done through evidence. Those evidence were collected by research. We try something, we see an observation, and based on that, we design a new procedure, a new guideline. But what is happening now? You all have heard of the story of chloroquine, a drug that has been used to prevent malaria in Africa for many years. I remember when I was young, my mother was putting it in yogurt because it was so bitter. And now what we've learned from a study that took place in Marseille in France, a study done on 24 patients, we've heard that chloroquine can help on treating people with COVID-19. And based on that statement, hospital in France decides against the Ministry of Health to start using it. In Senegal, as we are talking, it is being given systematically to any person that is COVID-19 positive. Now the challenge is research rely on a methodology. We have what we call clinical trial, randomized clinical trial, where we take different group of people, we give them different drugs, and we follow them all. And when we see a difference between the group, that's the only time we can say that there is an efficacy of a drug, which has not been done for this chloroquine. However, the President Trump has decided, authorized, that it can be used in his country, and many countries are taking the same direction. So the politics is now going beyond the actual research? Is it the end of evidence-based medicine? I hope not. Next slide. Now, a crisis, it's always an opportunity to be resilient. I start talking about giving a tribute to my father-in-law who died of COVID. And in the picture on the left, you can see my wife, Olivia, and my daughter, Ashanti, that Titi has the pleasure to know when she was in Cameroon. And what they are wearing are protective equipment that our Camerpad, the company that my wife and friend founded to produce washable and reusable sanitary pads, have now shifted. Say, okay, what can we do? First thing that we start was producing masks. You can see our daughter Ashanti is wearing a reusable mask. We use the same principle as we use for the sanitary pad to have different layers. Though it will not protect as much as the FFP2 and N95 will protect, but it's already a way to protect the population, because we've seen from Hong Kong, from South Korea, that mask is a very powerful tool. Now we also, as many countries, rely on China for the protective equipment. And then we decide, why don't we try to find ways locally to produce those API? So what you are seeing them wearing is our locally made protective equipment. This is an example of what our innovator, what our business people should invest in. How can we scale those local solutions to this global problem? And that will be done and has to be done with our own money, with the support of our government, but also the support of our philanthropists, who unfortunately, or maybe fortunately, this time they cannot run away and get access to healthcare somewhere else. We have to fight this fight together. We will devote our blood, our sweat, and tears to this just cause and ensure no one is left behind. Thank you. So now we'll be happy to take some questions.
Thank you so much, Professor Yap, for giving us that presentation. I think we are so lucky and fortunate to be able to talk to you, because you're right in the middle of everything that's happening. As you mentioned, we need to develop this infinite mindset so that the goal that we work towards is a better healthcare system in general, not just the end of the COVID-19 pandemic. From working with the Ebola outbreak, and even from seeing what's happening right now, what are some things that Africa's healthcare system, or Africa in general, has gotten right about responding to disease outbreaks, and what do we still need to learn?
So the thing we've done right is actually to implement quickly some of the measures that most countries took time. Once the closing of the borders, quite a number of African countries were quite early on closing their borders, especially those who knew that they could not really manage this kind of outbreak. Secondly, the implementation of some of those barrier and hygiene measures, washing hands. You have countries like the Democratic Congo, who were actually ongoing an Ebola outbreak. So those countries like Guinea and Sierra Leone and Liberia as well, and even Mali, Senegal, and Nigeria, they have already in place the memory of what they used during the Ebola outbreak. Nigeria, for example, was one of the first countries to give the sequence, the actual identity of the virus as soon as it arrived in the country. They were getting out of a Lassa fever outbreak, so they have a strong network, a strong system to track the case and their contact. So that's the memory of having those continuous outbreaks. But that, again, it's important to remind that first, Africa has many countries. Not all the countries have been exposed to Ebola and those outbreaks, one. And even within a country like Congo, which is a huge country, not all the part of the country have been exposed. So we should not also generalize, but we should appreciate that there is a memory that definitely makes
Oh no, I think Dr. Yap might be frozen for a bit. Let's see if he comes back. Okay, it looks like internet connection might not be so good, but I'm sure he'll be back on soon, hopefully. But just to carry on with what he was saying, I think that it's true that we have this knowledge of the virus in the past and how that has translated to today and how we're able to respond rather quickly. I know that the WHO was also trying to make sure that the countries that have a large population where diseases can spread rapidly, like Nigeria, they made sure that testing facilities were developed in those places so that the virus could be tested for. But that said, like Dr. Yap alluded to, we still do have a problem of not testing enough. So the numbers and the figures that we saw in the graph that Dr. Yap presented are probably underestimates. Okay, it looks like Dr. Yap might be rejoining us. Amazing. Okay, let's see.
Can you hear me?
Yes, we can hear you. Thank you for coming back. Okay, great. So thank you. You were just talking about the things that we've gotten right and the memory of having outbreaks such as Ebola in various African countries. Another question is about some of the current treatments. So someone's asking about chloroquine and how it might have side effects. Can you talk more about that?
Yes, definitely. I mentioned it when I was talking, and I was remembering how it all starts with that study done in France on the 24 patients, seeing some very promising results. And later on, they still have some promising results. But the challenge that we have with that drug is not whether it's actually work or not. It's one, we need to know who are the people who should receive the drug. Who are the people who should receive the drug, in which quantity, what is the dosage? When we were young, we were using it in prevention, like 100 milligrams. Now, to treat people, they can go up to 1,000 milligrams, which is a huge difference. Now, in Nigeria and even in France, some people have died, some because of overdose of chloroquine, and others because they were having some other disorder, including cardiac failure and so on. So definitely, there are side effects of the drugs. So before using such a drug, we need to have the right information. What is the dosage? How long should we use it? To which patient? If we use it with patients who have other disease, how can we monitor, how can we manage it? And the way we know to do it is to do a clinical trial. And it's important to have in mind that doing research is not exclusive to treating patients. Because when we do the research, we still give drugs to patients. So we have one group that is receiving the hydroxychloroquine and another one who is receiving something else. People have been talking about zinc. In Togo, for example, they're also assessing the traditional medicine. So this is an opportunity to have different groups of people taking different things, and we can follow them up all together. We'll know what are the side effects, and we'll know which one is efficacious at which dosage. Until we have those evidence, we won't be sure that it's working.
Thank you. Another question that we have is from Oscar. He asks, will the COVID-19 pandemic leave the global health system with the challenge to be working hand in hand with regional organizers and governments to national health systems to a standard level of good quality for all?
Well, I think that's definitely a solution that we will have to co-create. A pandemic is a complex problem. You have the simple problem, you have the complicated problem for which you have the solution, but a complex problem is a problem for which the solution is changing, is evolutive, and we have to co-create it. So how will be our global health after the COVID will develop us? How are we going to invest into our health as politicians, as I mentioned, as government, but also as innovators, as students? How are you making sure that the solution you are looking for are not all dedicated to application, to business, but also to that part? This is how we'll have a new mindset and a new healthcare that will again be a just cause toward providing quality healthcare for all.
Thank you. Another question by Lena is, why don't we try finance labs in Africa? We've seen a lot of innovation, but don't have enough money to face the virus and make studies. A similar question was that, how do we actually tackle this problem when we don't have PPE and that's personal protective equipment and other such resources that other countries might have?
Yes, I think first of all, let's go back to why do we have a poor healthcare system? Don't we have people who have money in the continent? Don't we have money in our continent? Yeah, of course we do. Of course we do. We have not as much as other continents, definitely, but we have some money that is being mismanaged. So if at all our government, again, they are the one who signed the Abuja Declaration. If they comply to that, there will be a change. Why Rwanda is not suffering like any other country in terms of healthcare system? Because they have invested in the healthcare system. So we don't have PPE. Why don't we have PPE? Why don't we have the capacity to produce them locally? Because we have not invested on our startup. We have not invested on our entrepreneur. The British like to say garbage in, garbage out. So we are just facing a poor investment that we have been doing. So rather than only focusing on ending the pandemic, which is a finite game, and which we will do, eventually we'll get out of this pandemic. The question is, how are we going to get out of it, and what will remain after that? After that, are we going to have the capacity to produce our own PPE? Are we going to sponsor our entrepreneur to produce masks? How are we going to reduce our dependence on China to produce all those things. This is what we have to do now. This is how we have to do now. And it's possible. On Monday, our government in Cameroon decided that everyone should be wearing masks. And everyone started producing masks. Of course, different quality, different norm, but at least people are doing something. Why? Because we have no choice. So just imagine if we catalyze those people, then we can have some amazing results. And that will not be done by the government alone. It will be also done by ourselves and our philanthropists. I know ALA is an impressive place to raise funding. So I'm really happy that African Leadership for Health has an initiative around COVID-19. And that initiative is also how are we now going to gather some effort, the funders, the entrepreneur, the anesthesia, and others to provide locally solution to this global challenge. So I really look forward to see how we are going to do that today.
Thank you. Another interesting question we have is, what about the BCG vaccine? And the BCG vaccine is what, for people who don't know, is what's used to vaccinate against tuberculosis. This person has read that it might confer some immunity against the virus. How do we find out if this is true? It seems it would be very important for Africa's policy decisions.
Yeah, definitely. You know, we are so desperate that we are looking for any positive news. And BCGs really sound like a good news. How did they come with that news? They took countries where the BCG vaccine were still implemented and countries who did not. And they realized that countries who did actually were doing better in terms of resisting to the COVID-19. Does that mean that people have a better immunity because of that vaccine? That is another question. And again, as I mentioned before, going back to the clinical trial, that's the only way to answer that. If we give the vaccine to a group of people, we don't give the vaccine to another group who are staying in the same environment, we follow them up, and then we'll have the evidence, whether it works or not. It brought a huge and viral conversation on internet, saying that Africa are not guinea pig, because two French researchers actually say that they were proposing to use vaccine in Africa. They did it in a very wrong way. But people have actually forgotten that they were actually talking about a vaccine that is being used in Africa almost every day. So now, to move that from a potential solution to an actual solution, we need to test it. And those trials has to be supported and done by our brilliant African researchers, because we do have a lot of them.
Thank you. Another question that came in that I think is important for us to address to be on the same page. What is the definition of an epidemic and a pandemic? And can we say which one is the case in Africa?
What is the definition between an epidemic and a pandemic? To be as simple as possible, I would say it's the actual stage. When we move, an epidemic can be declared once we have one case, depending on the disease. Once we have one case of Ebola, it's an epidemic. By the time to move to a pandemic, it means that we've reached a certain threshold globally, and in terms of number of people, and also the risk it might have to the entire community. That's where we move to a pandemic. But now another important definition is when we say it's emergency of public health, international public health, important. Because at some point, declaring those one as pandemic also help WHO and other boards to raise more funds to be able to respond to those diseases.
Thank you. Another question we have is that hand sanitizers are used to attack bacteria. Does frequent use of hand sanitizer help with the COVID-19 virus, which is a virus?
Yes, actually, if you read the indication in most of the hand sanitizer, you have a list of pathogens. And in that list, you will also find some viruses. Because those the good one, I mean, have been used for years and years and years against microbes, which include bacterial, but also virus, including the coronavirus.
Yes, thank you. Another question: do you think the reliance of African countries on traditional medicine has exacerbated this problem?
If it has exaggerated the problem, can you repeat the question, please?
So the reliance on traditional healthcare workers and traditional medicine, has it made the problem worse?
Not at all. At least with the evidence that we have right now, we haven't seen the outbreak being worse because of the use of traditional medicine. We haven't seen it. But on the other hand, it's important to remember what is traditional medicine. Before we have the modern, the Occidental medicine, people were living and surviving in Africa, which means they were finding their own way of taking care of themselves. Even the chloroquine that we are talking about is a synthetic form of what was extracted from plants. So which means in those plants were something that were protecting against malaria. So the nature, the modern nature, while they provide the disease, they also provide the drugs. So the traditional healers are actually people who have a better understanding of the nature and finding the herbs and the plant that can support us. So when those people will go and find plants that have an effect, an impact on our immunity because it has a lot of vitamin C, because it has some effect against virus or against anything, then why not? That's actually the reason why some countries went a way forward to actually test those traditional medicine in clinical trial. Benin is supposed to start. We launched a call for research proposal in Cameroon, and there were 2 or 3 proposals that include medicinal plants. So we hope that those people will get some funding and will be able also to challenge the modern medicine.
Thanks. There are also a few questions about MSF and what it's doing. So Gloria asks, how has MSF helped alleviate the pandemic in any way, like partnering with African governments?
Yes. So MSF currently is responding on different countries. For the first time, MSF is responding in Switzerland. There is also responding in France, in Italy, and of course in Africa. So in Africa, we are mainly in Niger, in Ivory Coast, in Burkina Faso, and of course in Cameroon. So the action of MSF is done along and within the government. So the government is the one coordinating the activity. And then we come and provide a support where there is a need, where we have an added value. One of the major differences between this outbreak and the Ebola and all the other outbreaks is that MSF used to rely on an important quantity and quality of experts coming from the West. But now with those borders that are closed, we are relying more and more on our local experts. That's why MSF WACA, West and Central Africa, for example, is managing the outbreak, the pandemic in Ivory Coast with our local experts. And this is also a tremendous opportunity for our experts to also be in the first line. The other challenge is the access to our material. We've been receiving them from abroad, But now we are challenged because of the border being closed. So that's also why we encourage locally made things.
Thank you. There are some questions that have to do with the lockdown, and the fact that transportation might be more limited now. So how best can we raise awareness to decision makers and influential businessmen of the importance of investing in the healthcare system, especially given the travel restrictions?
Yes, the lockdown is it's a real nightmare. It's a real nightmare, especially in countries where the majority of the population is living in a day-to-day basis. So how do we expect those people to eat and live if they are stuck in the house? They might die of hunger before dying of COVID-19. But at the same time, we all agree today that is one of the major tools to respond. Now, beyond the lockdown, beyond crossing or closing the borders, the question is what's next? Because after the health crisis will come the economic crisis. Our countries, our continent does not have the economic resources to respond to the COVID and beyond, especially the beyond. So though we don't have those resources, quite a number of discussion has started. For example, having the debt relief for African countries. So if we manage to have all debt relief, it will help us to invest more in what we think is important, is critical, which is health. So I hope, and I really hope, that's the strong message from this pandemic is please let us invest on what is the most important for us, which is our health. Quality healthcare for us must be our just cause.
Thank you. So just to let everyone know, we have about 8 more minutes of Q&A time, so I'll be taking about 3 to 5 more questions depending on time. We have a question that once again is talking about the relatively low number of cases we've seen on the continent. Is this because we have avoided the worst, or are we bound to face some more troubling news?
Well, I think first we have to understand how the virus moved. As per now, there were almost, if no case coming imported from China to Africa. Most of our cases, if not all, were coming directly from Europe to Africa, which means even logistics first have to leave from China to Europe to have a critical mass of people being contaminated in Europe and a proportion of them starting coming to Africa. So it took time, which also means that we are not at the same level of the outbreak as the European and the American are. So is it going to be as worse as it is in those continents? Maybe no, because we also have a very young population, extremely young. And we know that now that the virus affects mainly our elders. So that might be a protective for us. On the other hand, we are also affected by other infectious diseases, malaria, typhoid, diarrhea, and those diseases will not leave just because COVID is coming. So how the interaction between the two are going to happen, we don't know. So I think though we don't have the answer, we don't have control of what is going to happen, but we have control on what we are doing. Washing our hands, social distancing, making sure that we reduce the contact, wearing masks when we are in public, those are the measures where we have control. And of course, thinking about those we don't have the money, the support to be in a lockdown. Let's make sure that we have that African solidarity.
Yeah, that's some good practical tips on what we can be doing. There are a few questions about technology and about how digital health technologies can be used to achieve this goal of better healthcare for all.
Yes, technology will play a tremendous role. So, of course, I will take an example of what is happening in Cameroon with iDoctor, that you know also a bit. So iDoctor is a startup connecting health professional and patient. So what we are doing now during the COVID is to provide remote care to patients, those first who are suspicious of having COVID, but who don't want to go to the hospital where they should not go, and they cannot access the phone that is being given by the Ministry of Health. So we can help to make that triage. But we can also support those who have or actually have actual other disease. And that's also how the telemedicine can play a tremendous job on keeping access to quality care to people even during that big pandemic. So that's a role, critical role, that it can play in Africa. In Asia and in Europe, we've seen the use of phone for tracking. I think Senegal is also thinking about using phone to do contact tracing. Some countries are thinking about it, but I believe that it might not be the most urgent. The most urgent is to sensibilize the people, the population, and giving them the means to respect and to comply to the rules.
Okay, another question is there an effective and rapid way to gain power from money investment in the health sector?
Definitely. I mean, if all the people listening this webinar manage to raise funds around them to either to support and to invest or to advocate in their blog, in their tweets, at some point we will create a movement. And that movement will make quality healthcare for all a just cause. So if we start from here, Health for Health will also be leading the movement. Then this outbreak will make us actually resilient. By resilient, I mean being better than we were before the pandemic. This is my hope.
Thank you. And then another question is, like, moving forward and looking at the future, what systems need to be in place for us to be able to better tackle future pandemics or disease outbreaks that we might see?
Yeah, that's a very good question to conclude, is going back to what we call infinite game, infinite mindset. What do we need to build our healthcare profession? In healthcare, not building huge hospital, but we need to actually tap into technology to make the healthcare accessible to people wherever they are. We will never have enough doctors for everyone. But the technology actually allows us, using our phone, using different technology to provide the healthcare at different level. I mean, if we all decide to invest into that training, technology, infrastructure, then you will see the difference. Now, this outbreak will leave us all different. We've realized that we cannot take our jet to access healthcare in London. It's no longer possible. We also realize that we are losing our family members without having money or not. So this is a real call for all of us. Let's make sure that we invest in what we think is the most critical, our health. And to conclude, I would say to achieve that, as I already mentioned, there will be sweat, tears, and blood to ensure that no one is being left behind.
Thank you so much, Professor Yap, for engaging in all these questions. And thank you to everyone who is attending and asking all these wonderful questions. I'm going to hand it over back to the team on campus to formally conclude the evening.
Hi everyone, my name is Khalalelo from South Africa, and I'm the coordinator for the Executive Speaker Series here at ALA. I would like to firstly thank Diti for facilitating tonight's session so beautifully. Job well done to you. And of course, I'd like to sincerely give a vote of thanks to Professor Yap for joining us tonight. I personally am a person who finds it very difficult to grasp medical terms and wrap my head around it, but your presentation was very easy to follow and very insightful. So thank you very much for that. And just on behalf of ALA, I'd like to extend my sincere condolences to you and your family on the recent loss of your father-in-law. So we'd just like to extend those condolences to you. Lastly, I'd like to thank everybody else who's joined us tonight, really from across the world, and invite you to please reach out to us if you have recommendations for amazing speakers or industry experts, such as Dr. Yap, but really on any topic that is relevant to our continent, that you'd reach out to us on info@africanleadershipacademy.org. That's info@africanleadershipacademy.org. And lastly, and in closing, I'd like to invite you to next week's session will be happening at the same time. This time we'll be having Justice Edwin Cameron, who will be speaking on public health and human rights. So I invite you to please look out and register via the invite that will come to you. But otherwise, for myself, the ALA team, please stay safe, please stay healthy, and thank you very much for joining us. This is the end of the session.
Thank you. Bye-bye.